Welcome back. Medical and nursing managers at Northdale Hospital in Pietermaritzburg have been suspended. This follows the death of a man treated in a makeshift tent flu ward in the hospital's parking lot. The KwaZulu-Natal Health MEC has also redeployed the hospital's acting CEO to her original position as a maternal health specialist. Mawanda Keswa is following this story for us. He joins us live. So, Mawanda, of course, outrage about what's happened there. What's the health department done so far to actually address this?
Well, the first thing is that in a statement, the health department has stated that the suspensions were to allow for the investigation following the death of a 67-year-old man who died on Saturday at the hospital after being treated at a partially covered flu clinic in the hospital's parking lot. Now, the MEC says that of the 70 hospitals in the province, each and every one of them was given a directive to identify a space that would be used for the treatment or the screening of patients. And if they did not have a suitable area to do that, they were given the directive to go into their budgets and use those funds to erect a temporary structure. Most of the hospitals then did that. However, the issue with Northdale is that she says people didn't do the work that they were expected to do. Now, she had said that what was done then today is that they erected temporary structures that had adequate heating. And indeed, we were able to see some of those structures. In fact, there were tents. We were at the hospital, and we were able to actually see those tents at the hospital. At the time, we weren't really aware if those were to address the issues that were raised by the public following the death of the patient. However, after communication with the departments in the statement that they released, it was then clear that that structure indeed was to fulfill the role that the MEC says the structure was erected for.
Yeah, so what's the situation at other hospitals with regards to these flu clinics or fever wards?
Well, the MEC says that all hospitals, like I said, 70 of them, do have these flu clinics. The issue, however, that was picked up at Northdale Hospital is one that needs to be addressed, and as a result, there are those suspensions, and there is also the temporary structure that has been erected. However, she has also looked into the fast tracking of a more permanent structure that may be built at Northdale. However, in other hospitals, there haven't really necessarily been any issues that have been flagged with the structures that have been identified in those hospitals. It's not clear how many have areas that they could have used within the hospitals versus those that had to erect temporary structures in other areas of the hospitals, because she says some issues with the other hospitals are around the spatial planning and the space available to identify parts of the hospitals that can be used, such in the case of Northdale, where they couldn't find a suitable spot within the hospital, then they had to move to the parking lot.
So, Mawanda, let's talk about the reaction from the Premier and the Health MEC themselves. A statement they think is good enough to deal with this situation when, in other instances, they hold media conferences to boast about them helping facilities in rural areas. Have you managed to speak to the Premier's office about what's going on?
Well, I reached out to speak to the MEC, and I was told that she had been in various EXCO meetings and therefore would have not have been able to conduct an interview. Hence, she opted for the release of a statement, rather. And that was the communication that I had received following reaching out to try and get comments from the MEC herself. That's the response and reaction that we received. We would presume that as it's done every Sunday, they do hold that briefing. And I presume that this will be something that will come up once again and will be raised, that in times or in situations such as these, why are we unable to then secure interviews, because you do hold these press conferences when there are messages that you want to relay. However, when a situation is not necessarily in your favor, it may seem as though it is quite more difficult to have you face to face in front of a camera versus you releasing a statement.
Yeah, it is unacceptable, and we should not stand for that. I have tried to speak to the Premier. His spokesperson says the MEC is handling it, but clearly she's too busy to deal with somebody dying in a tent. We're going to leave it right there. Our reporter, Mawande Keswa, and Premier Cecil Kalala, come on the show. More than welcome to.